Hey everybody, it's Robert, registered massage therapist and instructor of Ligaments articular strain technique. Thanks for being here this week with me. I just wanted to talk to you guys very quickly about posture. Now, not your posture or your biomechanics while you're treating, but more of your patient's posture. Now, when I went to school a long time ago, as I'm sure some of you have, and even today in today's curriculum, they still teach a ton about what is correct posture or bad posture or terrible posture, what is head forward posture, what is a military brace posture. And I've been doing a literature review because I do have a course titled Postural Correction Techniques, where I take Andrew Taylor Still's ligamentous articular strain techniques and I apply them to the anterior aspect of the body in order to make some postural corrections, or actually not really postural corrections. I don't like using correction as a term, but more bringing, awareness to the patient as to what a more functional position may be for their body to function in or to live in. So in doing a literature review and a research review, I really wanted to delve into and ask, some of the questions against the myths and the trends of why do we do an initial scan exam? Why do we assess someone's posture? Why are we using the negative terminology for bad posture or terrible posture, or that's a migraine posture, or whatever kind of terminology you're using, whatever kind of adjectives you're using to your patients. And I really want to challenge you guys to actually change your terminology and change your perception on how you view posture. What I'd like you guys to do is to actually think, is it faulty or is it functional? And that's it. I don't want you guys to correlate it towards pain or anything like that, because in the majority of the cases, even a proper posture held for a specific period of time or a long period of time, what you would consider a proper posture or a proper ISE exam posture, even holding that for a long period of time, it's going to cause pain. And it's not the posture that actually causes the pain, it's the staticness of movement, it's the lack of movement that the tissues are being stuck in. So anyways, you guys have all seen this image before. This is an image that I borrowed from Eric Dalton, who's a massage therapist down in the States. For all of you, you should know who Eric Dalton is. And this is, so I'll credit him with this image where he's got, the anatomy model standing in, what most of us were taught to be, to show as being a correct sort of posture. And then when the head goes forward a little bit, you get a 32-pound increase because the average head weighs around 10 to 13 pounds. And then when the head really goes forward, it's a 42-pound increase in weight. So I really wanted to look for the research to sort of justify that. It's like, well, where did that come from? Like that, I know that that's what we got taught, but nobody ever told me why or how or what the research was that showed that. So I went to the internet, I asked some questions, I got some feedback from some amazing therapists out in the world. Thank you very much for contributing to this goal of mine of trying to find the evidence and the research behind this myth or this theory. So what I found was that in a textbook called The Physiology of Joints by Kapanji, there was a quote that said, for every inch of forward head posture, it can increase the weight of the head on the spine by an additional 10 pounds. And that's from Kapanji, Physiology of Joints, Volume 3. But it didn't say where he got that information from. So I continued on my journey of digging for this information, and I found a third edition of Soft Tissue, Pain and Disability by Renee Calais, MD, in her pain series, or in the pain series. And in that series, they talk about if the head weighs 10 pounds at the center of the ear and it sits directly over the center of the shoulders, the load on the spine and its tissues is only about 10 pounds. However, if the head is translated forwards, its weight will increase by 10 pounds for every inch forward that it is. In effect, the center of the ear is 3 inches from the forward to the center of the shoulders, and the weight of the head on the spine and its discs, joints, and nerves is 30 pounds. So they're saying that for every inch forward, the weight increases by 10 pounds. So if my head is here, my head weighs around 10 pounds. If I go an inch forward, it weighs now 20 pounds, an inch forward again, 30 pounds, an inch forward again, sort of 42 pounds, which kind of goes in line with the image that Eric Dalton has. Well, I wasn't really satisfied with that because, again, it wasn't really research. It was more of a quote in a book. So I did some more digging. It took a while to find this, but what I did find is I found a medical doctor who is a chief of spine surgery, New York Spine Surgery and Rehabilitation Medicine, New York, by the name of Dr. Keith Hansraj, MD. And this was the assessment of stresses in the cervical spine caused by posture and position of the head. So, in his research paper, he says, as far as we're aware, and after a review of the National Library of Medicine publications, there is no other study available to assess the stresses about the neck when incrementally moving the head forward. Well, it's no wonder we couldn't find any of this research. It's because he's now saying that in his research, looking for this research from the National Library of Medicine publications, that it doesn't exist. So he went forward and he did the research. And what was interesting was that it's actually somewhat true. When looking at the physics of this, and this is what a number of people had said on Facebook also, is that, you know, when you hold an object closer to your body, it tends to weigh whatever the object weighs, but when you hold it further away from your body, it tends to be a perceived increase in weight. So anyways, his research, which I will post underneath in the video notes for this, it actually showed that, you know, at about 0 degrees, where they measured the center of mass for the neck and the weight of the head, the weight of the weight of the head weighs around 10 to 12 pounds. But at about 15 degrees, it increases to 27 pounds, at 30 degrees, 40 pounds, and then when you get to 60 degrees of forward flexion, so basically for those of you that are sitting on your phone text necking or looking down at your phone while you're watching this video, you have your head now is placing 60 pounds of force onto the neck. So it was really interesting to go through that process, to look for the information, to sort of demystify this myth and this trend that we were sort of all taught, but no one was able to link it to actual research. So it was great that that Dr. Hansraj was able to do this research and publish it, to sort of put the myth and the trend to bed, actually. So as far as manual therapy goes, because I'm a registered massage therapist, I'm a manual therapist, I love treating my patients. I'm a very structural guy. I like getting into the meat and potatoes of manual therapy. You know, does it really matter? You know, does what we do really matter for the posture? And what I want you guys to really grasp is that we're cultivating body awareness. That is essentially what we're doing, is we're taking people that are having an inability to be aware of their posture, their functionality, and we're bringing more awareness and more presence to them. And going through the research, I won't get really too long into this, but there's a ton of research that I was able to find that basically is re-educating us on why we should treat posture, why it's important, and why it's not important in some cases. So firstly, posture and pain are not correlated, but that the real issue is a loss of functionality. So it doesn't matter what position you're holding yourself in. If you hold yourself in that position for a long period of time, it's going to get painful. More because of the staticness of the position rather than the actual position that you're in. Forward posture causes a loss of cervical range of motion. That's just pure physics and biomechanics. That's been proven. Forward posture causes a loss of meaningful movements. Well, for example, meaningful movements would be you need to look up at the light in order to see if you can cross the crosswalk. If you are completely forward flexed, well, your eyes aren't going to be able to see where you're going. Also, what your body likes to do is it likes to keep your eyes horizontal so that it can see where it's going. So in order to do that, you actually have to contract the very deep muscles of the cervical spine. And when you do that, that causes a ton of compression and stress and strain and loss of energy to those muscles. And the peripheral muscles actually aren't affected as much as the deep cervical muscles are. Forward posture causes a decrease in quality of life. That's been proven. Forward posture, they've actually shown, has a huge effect on the endocrine system. If you take people that are generally very emotionally positive and you put them into a position of forward flexion, which would sort of lead you to think, like sort of a psychologically depressed state, these people will actually become depressed. They will change from a very positive attitude to a very depressed attitude, a very negative attitude. So posture causes a decreased quality of life as far as the endocrine system is concerned. Forward posture causes an increase in muscular fatigue. So we talked about that for the deep cervical spine. Forward posture also causes proprioceptive and kinesthetic awareness issues. It causes neurovascular compression that can possibly lead to peripheral degeneration over the long term. It causes long-term osseous changes in response to stress and load, so you can actually get vertebral osseous changes. You can also get osseous changes to the shoulders, because as the shoulder anteriorly rotates or internally rotates, you can get a circumflex artery compression that will actually diminish the amount of oxygenated nutritional blood flow to the head of the humerus. So that's actually been proven with research too. Forward and extended posture causes a change in center mass, which requires a correcting response. So it's not just forward posture that will cause you to have to invoke changes in order, or neuromuscular changes in order to correct your posture, but also going into hyperextension will also cause that. Forward posture causes impairment in postural control with walking. It interferes with upright stance and what else? Modifying a posture. Now, with posture, it's more of a habitual effort that this patient or your patients are presenting with. It's a habit. It's a learned habit, and sometimes it's a learned habit because they've been in pain and they've assumed a posture in order to try and get away from the pain or run away from the pain for that fact. It's a biopsychosocial event is what it is. There's biological aspects that are playing a factor. There's social aspects, there's psychological aspects that all play a part in posture. So you really do need to address all three of those when you are, if you are going to take on the challenge of making a change to someone's postural habits. Looking into the study of habits, what you need to also realize is that habits are sort of they form in three parts. There is a reminder or a trigger that stimulates an event. There is a routine that happens, and then there's a reward that happens afterwards. So, for example, what would cause a head forward posture would be, for example, texting. Now, text neck, a lot of people were correlating text neck to pain and to headaches. And what the research found was that it wasn't necessarily the posture that was the problem, but it was the activity or the event that the activity that the people were doing. So texting, receiving a text, playing games on cell phones, those all caused a sympathetic nervous system stimulation, which caused a change in respiration, a change in blood flow, a change in heart rate. And being in that sympathetic nervous system overload for an extended period of time, that actually led to increased pain, increased endocrine changes, and increased migraines in the patients. So again, the habit isn't the posture, the habit is the activity. So for example, with the cell phone and the text message, your phone goes ding. That's the trigger. Your routine is you grab your phone, you look down on it, or you decide that, you know what, I need some cortisol injection in my brain. I'm really getting kind of bored. It's been kind of one of those days. I need a stress relief, so I need to play one of these cell phone games. So you play the cell phone game, there's your routine, and the reward is that you get this, this cortisol hit, right? You get this feeling of satisfaction that you played a game and you accomplished whatever level of game you were playing. So you need to change that habit. So the habit would be, you feeling maybe bored, or you need that cortisol hit. Well, instead of the routine being getting onto your iPad or your iPhone or your Android or whatever computer and playing a game, that routine needs to change. You need to go for a walk outside. You need to give your wife or your husband a call. You need to talk to your kids. You need to do something that gives you the same reward as what that playing the game routine would give you. Now, that all takes time. It takes consistent hard work, and it takes consistent effort on not only the therapist, but also more so the patient. And with habits, there was sort of, again, another myth that you needed a minimum of 21 days to change a habit. Well, when you really look into the research, it's a minimum of 21 days and a maximum of 2 years before that habit will change. So if you are planning on taking on the challenge of making a change in posture to your patients, you really do need to identify what that primary habit is that is contributing to the posture, and you need to change that. And then it has to be a consistent effort that can last up to 2 years. So you guys really need to have, a good patient-therapist contract and understanding with each other about what you're going to accomplish, and maybe set out some defining factors as, what's going to happen at 3 months, 6 months, 9 months, a year, and then so on afterwards. So anyways, is it really worth the effort to try and make a change to your patient's posture? And as always, it depends. It depends on what the patient wants, what the long-term goals are, and what your long-term goals are as a therapist with your patient are. So just always realize that posture is a biopsychosocial event. It's a habit, and it's a lot more in depth than what we think it is, than just a higher shoulder or a lower shoulder. And that's the other thing. When you do your ISEs, how do you know if it's a higher shoulder or a lower shoulder? Is one shoulder being pulled up away from gravity, or is gravity pulling one shoulder down? Just another tangent for me to go on in another video. But anyways, I really hope that you guys enjoyed the information and this video on posture. I hope that it changes your perspective on how you approach posture with your patients. And if you have any questions or comments, please leave the comments down below. If you're seeing this video anywhere other than on my blog site, please head over to lastsite.ca, click on the blog section, look for this video, and watch the other videos that are there. I've also got videos on YouTube and Facebook. So leave me a comment, any questions, any concerns, any thoughts, any ideas, and I'd love to hear from you guys to see what your perception is, what your ideas are around posture and what you've found, and if any of this stuff is new, or if this is stuff that you already were aware of, and this is just confirmation for you guys. So anyways, have a great day. Hope you enjoyed the topic, and I will see you in the next video.